The freedom convoys in Canada and now several European countries, and the growing sovereign citizen movement in the United Kingdom. Both are based on anti-vaccine anger, and both have been fueled by misinformation about COVID-19 jabs. Let me show you one example of a false claim that has continued to circulate. In the United Kingdom, it is the National Week for testing HIV, the virus that causes AIDS. And that has led some people to make false online claims that there is an apparent link between COVID vaccines and a new form of HIV. Many people make reference to an apparent disease called vaccine-acquired immunodeficiency syndrome, or VAIDS. And other people are also making false claims that a COVID-19 vaccine might actually have created the new HIV variant that was recently discovered in the Netherlands. But those claims are all false. Let me show you why. Firstly, if you go onto the original study that found that new HIV variant, you can see that it is not new in itself, and the variant was actually around long before COVID vaccines existed. Here it says that it first arose in the late 1980s and 1990s, and has actually been declining since around 2010. So there is no link between a COVID vaccine and that new VB variant. But of course, more widely, there is no clinical evidence to suggest any connection between COVID vaccinations and any form of AIDS. You yourself can go onto the website of the European Centre for Disease Control and Prevention or the World Health Organization. And if you search for VAIDS, you will get no results. It is not a condition that they are aware of. And given that billions of people have now had at least one dose of a COVID-19 vaccine, health experts say that any such condition like this would have been documented. What health experts are saying is that COVID vaccines continue to be safe and effective against the virus, and that any risks are extremely rare. But certainly, there is no clinical evidence to suggest any connection between a COVID vaccine and any form of HIV.